Hi, welcome to Professional Certifications channel. Let's break down RHIT exam preparation, one topic a day for focused and effective learning. Today's topic is Integrated Health Records.
Definition: Integrated health records refer to a system of organizing patient health information in a manner that combines clinical data from multiple healthcare providers and facilities into a single, unified record. This approach ensures that a patient's complete medical history is accessible to healthcare providers across different specialties, locations, and stages of care. Integrated health records support the seamless exchange of health information, improve care coordination, and reduce the risk of medical errors by providing a comprehensive view of the patient's health status, treatments, and outcomes. Integrated health records are typically made possible through the use of electronic health record (EHR) systems and health information exchanges (HIEs) that allow different healthcare providers to share patient information securely and in real time. This integration is critical for improving the quality, efficiency, and continuity of care, particularly for patients with chronic conditions or those receiving care from multiple providers.
Key features of Integrated Health Records. 1. Comprehensive patient data. Integrated health records provide a comprehensive view of the patient's medical history, including diagnoses, treatments, medications, allergies, lab results, imaging, and social determinants of health. This ensures that all relevant health information is available to any authorized healthcare provider involved in the patient's care. Example: a primary care physician can access a patient's recent hospital discharge summary, lab results, and specialist recommendations through the integrated health record, ensuring continuity of care after hospitalization. 2. Real-time data sharing. Integrated health records support real-time sharing of patient information between healthcare providers, improving communication and coordination of care. When a patient's data is updated by one provider, it is immediately accessible to other authorized providers. Example: when a patient receives care at an emergency department, the attending physician can view the patient's medication list and recent lab results in real time, allowing for informed decision-making and avoiding potential drug interactions. 3. Health Information Exchange (HIE) integration. Integrated health records often rely on health information exchanges (HIEs) to facilitate the secure sharing of patient data between different healthcare organizations, including hospitals, clinics, pharmacies, and laboratories. HIEs ensure that patient data flows seamlessly between systems that may use different EHR platforms. Example: a patient's imaging results from an outpatient clinic are shared with their oncologist at a different hospital through the regional HIE, allowing for coordinated cancer treatment planning. 4. Continuity of care. By integrating data from various providers and settings, integrated health records ensure that a patient's health information is continuously updated and available across the continuum of care, from primary care visits to hospitalizations, specialty care, and home health services. Example: a patient's integrated health record includes information from their primary care provider, cardiologist, and physical therapist, providing a complete picture of their ongoing heart condition management and rehabilitation. 5. Interoperability. Interoperability is a key feature of integrated health records, ensuring that different EHR systems can communicate with each other and exchange data in standardized formats. Interoperable systems allow for seamless data sharing, even when providers use different software platforms. Example: a physician in one hospital system can view a patient's medical records from another hospital system, even if the two systems use different EHR platforms, thanks to standardized interoperability protocols. 6. Patient access to health information. Many integrated health record systems offer patient portals that allow patients to access their own health information, such as lab results, visit summaries, and medication lists. This empowers patients to take an active role in managing their health and improves patient engagement. Example: a patient uses a secure online portal to view their recent blood test results and communicate with their healthcare provider about treatment options, promoting better self-management of their condition. 7. Clinical Decision Support (CDS) integration. Integrated health records often incorporate clinical decision support (CDS) tools that provide healthcare providers with alerts, reminders, and recommendations based on the patient's health data. CDS tools help providers make evidence-based decisions, improving patient safety and outcomes. Example: a physician receives an alert through the Integrated Health Record System when a patient is prescribed a medication that could interact with another drug they are taking, prompting the physician to adjust the treatment plan.
Benefits of integrated health records. 1. Improved care coordination. Integrated health records enable seamless communication between different healthcare providers, ensuring that everyone involved in a patient's care has access to the same information. This improves care coordination, especially for patients with complex medical conditions or those transitioning between care settings. Example: a hospital discharge team shares a patient's treatment plan with their primary care provider and home health agency, ensuring continuity of care as the patient transitions from the hospital to home. 2. Enhanced patient safety. By providing a comprehensive view of a patient's medical history, integrated health records reduce the risk of medical errors, such as duplicate tests, missed diagnoses, or harmful drug interactions. Providers have access to all relevant data, allowing for more informed clinical decision-making. Example: a patient's integrated health record alerts the prescribing physician that the patient is allergic to a specific medication, preventing an adverse drug reaction. 3. Reduced redundancy and healthcare costs. Integrated health records eliminate the need for redundant tests and procedures, as providers can access previous test results, imaging studies, and treatment plans. This reduces unnecessary healthcare spending and streamlines care delivery. Example: a specialist reviewing a patient's integrated health record sees that the patient had a recent MRI, eliminating the need to order another imaging study. 4. Better chronic disease management. Patients with chronic conditions often see multiple healthcare providers. Integrated health records help providers collaborate on the management of chronic diseases, ensuring that all aspects of a patient's care are coordinated and consistent with treatment goals. Example: a patient with diabetes receives care from an endocrinologist, primary care physician, and dietitian. The integrated health record allows all providers to access the same health data, ensuring that treatment plans are aligned and complementary. 5. Increased patient engagement. Integrated health records that offer patient access through portals or mobile apps empower patients to take an active role in managing their health. Patients can view their health information, monitor their progress, and communicate with their healthcare providers more easily. Example: a patient uses a mobile app connected to their integrated health record to track their blood glucose levels, schedule follow-up appointments, and communicate with their diabetes care team. 6. Enhanced population health management. Integrated health records provide valuable data that can be used to track population health trends, identify at-risk groups, and implement targeted interventions. This data supports healthcare organizations in managing public health initiatives and improving the overall health of communities. Example: a public health department uses data from integrated health records to track vaccination rates in a specific region and implement outreach programs to increase immunization coverage. 7. Regulatory compliance and reporting. Integrated health records make it easier for healthcare organizations to meet regulatory requirements, such as quality reporting and compliance with privacy regulations like HIPAA. The ability to generate accurate, comprehensive reports from integrated data reduces the administrative burden on healthcare providers. Example: a hospital uses integrated health record data to report quality metrics to the Centers for Medicare and Medicaid Services, CMS, for value-based care programs, ensuring compliance with reporting requirements.
Challenges of integrated health records. 1. Interoperability barriers. One of the biggest challenges in achieving fully integrated health records is the lack of interoperability between different EHR systems. Without standardized data exchange formats, it can be difficult to share patient information between systems from different vendors. Example: a clinic using one EHR platform struggles to share patient data with a hospital that uses a different system, resulting in incomplete medical records and delayed care. 2. Data privacy and security concerns. The increased sharing of patient information across healthcare organizations raises concerns about data privacy and security. Integrated health records must comply with privacy regulations such as HIPAA, and organizations need to implement robust cybersecurity measures to protect patient data from breaches. Example: a healthcare organization must ensure that all patient data transmitted through the Integrated Health Records system is encrypted and accessible only to authorized users to prevent unauthorized access. 3. Cost of implementation and maintenance. Implementing and maintaining an integrated health records system can be costly, particularly for smaller healthcare organizations. These costs include purchasing technology, training staff, and ensuring ongoing support for the system. Example: a small rural hospital faces challenges in securing the financial resources needed to implement an integrated health records system and connect with the Regional Health Information Exchange (RHIT). 4. User resistance and workflow disruption. Healthcare providers may be resistant to adopting new systems, especially if they perceive integrated health records as adding to their workload or disrupting established workflows. Effective training and change management strategies are needed to overcome this resistance. Example: physicians in a hospital are hesitant to use the new integrated health record system due to concerns about the time required for data entry and the potential disruption to their clinical workflows. 5. Data accuracy and standardization. Ensuring the accuracy and consistency of data across integrated health records is critical for maintaining trust in the system. Different providers may document patient information differently, leading to inconsistencies or incomplete records. Example: a patient's medication list in the integrated health record is not updated by one of the specialists involved in their care, leading to confusion about the current medications being taken. 6. Patient consent and data sharing preferences. Patients may have concerns about how their health data is shared and with whom. Integrated health records require clear communication with patients about consent for sharing their information across different providers and facilities. Example: a patient expresses concern about sharing sensitive health information, such as mental health records, with providers outside their primary care team. The healthcare organization ensures that the patient's preferences are respected through consent management tools in the integrated health record system.
Best practices for implementing integrated health records. 1. Prioritize interoperability. Healthcare organizations should prioritize selecting systems that support interoperability and use standardized formats, such as HL7 or FHIR, for data exchange. This ensures that patient information can be shared seamlessly across different providers and EHR platforms. Example: a hospital implements an EHR system that adheres to the FHIR standard, enabling smooth data exchange with local clinics and other healthcare providers using different systems. 2. Engage stakeholders early. Successful implementation of integrated health records requires the engagement of key stakeholders, including healthcare providers, IT staff, and patients. Involving them early in the planning process helps address concerns, gather feedback, and ensure that the system meets the needs of all users. Example: a healthcare organization forms a steering committee that includes physicians, nurses, IT professionals, and patient representatives to guide the implementation of the integrated health record system. 3. Invest in training and support. Comprehensive training is essential for ensuring that healthcare providers and staff understand how to use the integrated health record system effectively. Ongoing technical support should be provided to address any issues and ensure that the system is functioning smoothly. Example: a hospital offers extensive training sessions and provides on-site IT support during the first few weeks of using the new integrated health record system to help staff navigate the transition. 4. Implement strong data security measures. Ensuring the privacy and security of patient data is critical for integrated health records. Healthcare organizations should implement strong encryption, access controls, and audit trails to protect patient information from unauthorized access and breaches. Example: a clinic uses multi-factor authentication and role-based access controls to ensure that only authorized staff members can view or modify patient data in the integrated health record system. 5. Monitor and evaluate system performance. After implementing an integrated health record system, organizations should continuously monitor its performance, gather feedback from users, and make improvements as needed. This ensures that the system remains effective and meets the evolving needs of healthcare providers and patients. Example: a healthcare provider regularly surveys physicians and nurses to gather feedback on the integrated health record system's usability, and makes updates based on their input to improve the user experience. 6. Educate patients on the benefits. Healthcare organizations should educate patients about the benefits of integrated health records, including improved care coordination and access to their health information. This helps build trust and encourages patients to take an active role in managing their health. Example: a healthcare provider offers educational materials and holds informational sessions to explain how the integrated health record system improves patient care and how patients can use the online portal to access their health information.
Future trends in integrated health records. 1. Increased use of artificial intelligence, AI, and machine learning. AI and machine learning will play a growing role in integrated health records by providing predictive analytics, personalized treatment recommendations, and automated clinical decision support. These technologies will enhance the ability of healthcare providers to use integrated data for more precise and timely care. Example: a hospital uses AI tools integrated into the health record system to predict which patients are at high risk for readmission, allowing for early interventions and improved care management. 2. Blockchain for data security and interoperability. Blockchain technology has the potential to enhance the security and interoperability of integrated health records by providing a decentralized and tamper-proof system for storing and sharing health data. Blockchain could ensure that patient records are accurate, secure, and easily accessible across different providers. Example: a healthcare organization adopts a blockchain-based platform to securely store and share patient data, ensuring that all providers have access to the same accurate information and reducing the risk of data breaches. 3. Wearable devices and remote monitoring. Integrated health records will increasingly incorporate data from wearable devices and remote monitoring tools, allowing healthcare providers to track real-time patient health metrics and integrate this data into the patient's overall health record. Example: a patient's integrated health record includes data from their wearable fitness tracker, such as heart rate, physical activity, and sleep patterns, which are used to monitor their recovery after surgery. 4. Telemedicine integration. As telemedicine becomes more widespread, integrated health records will incorporate telehealth data, ensuring that virtual visits, remote monitoring, and telemedicine consultations are seamlessly integrated into the patient's medical history. Example: a telemedicine consultation with a specialist is documented in the patient's integrated health record, allowing the primary care provider to view the specialist's recommendations and incorporate them into the treatment plan. 5. Focus on patient-centered care. Future developments in integrated health records will focus on improving patient-centered care by providing patients with greater control over their health information, personalized care plans, and tools for self-management of chronic conditions. Example: a healthcare provider offers patients access to a mobile app connected to their integrated health record, allowing them to track their health goals, view personalized wellness plans, and communicate with their care team in real time.
Conclusion: integrated health records are a critical component of modern healthcare, enabling seamless sharing of patient information across providers and facilities, improving care coordination, and enhancing patient safety. By consolidating a patient's medical history into a single, unified record, integrated health records support informed clinical decision-making, reduce redundancy, and empower patients to take an active role in managing their health. However, challenges such as interoperability barriers, data privacy concerns, and the cost of implementation must be addressed for successful adoption. For RHIT exam aspirants, understanding the key features, benefits, and best practices for integrated health records is essential for supporting healthcare delivery and promoting the effective use of health information technology.